My name is Dr. Sabine ZENKER. I'm a dermatologist from Munich, Germany, and I will showcase you today the use of the Pluryal range in this patient. First of all, Pluryal volume to enhance the projection of the cheek area. Then we will redefine the perioral area with Pluryal. First of all, we have to assess the patient's face. In her case, the aging process starts to show up in forming a pre-jowl sulcus, thin lips, and a reduced projection of her cheek area. So we decided to enhance the curve and the projection of her cheek area, as well as to rejuvenate the perioral area. I will start with Pluryal volume in her upper cheek. To give a GPS, a kind of instruction on where to go and where not to go in a face, we will draw some mapping on her face. So the no-go area obviously is above the infraorbital rim, and we will certainly avoid the infraorbital foramen. A zone of danger obviously is the triangle here, as the facial artery runs along here. If ever we'd inject the whole lower face in her, the no-go zone is obviously the jowl. The second lines are done to find the entry points. There is one line which comes from the triangle, the alar triangle, and goes to the tragus. This line tells me to stay deep with the injections above this line, whereas if ever she was wrinkling here, we stay subdermally below this line. The next line we draw are the strategic lines to find the entry points. In her, we need one entry point for her cheek area. We do find this by marking the lateral orbit going down, and where this line crosses the line which comes from the mid-mentum, crosses the corner of the mouth and comes up to the cheek area. This is the entry point where I start the injection. The second and possibly third injection will be medial and lateral to this in a banana-wise shape. So these are the lines we do at least theoretically draw on a patient's face to plan our injection strategy. Straight to the bone. Now withdraw, to make sure that aspiration test is negative. And now I do place the filler in a bolus-wise, gunshot-wise way, and I do place in a tunneling way 0.2 of Pluryal volume. Second sign, we do place on the cheek apex point, gunshot-wise, a 0.2 in a tunneling way. On withdrawing the needle, we place 0.2 mil on one point, and a second point in a banana-wise fashion. Okay, just lateral to the first one. This elevates the cheek in a very nice and natural way. We will work around the mouth area. In her, it starts to create a crease, a fold in the pre-jowl sulcus area, so we will build foundation with Pluryal volume and then refine the whole direct area around the lips. It's again the 27 gauge needle, 45 degree, and then we lift up, and the needle sits at the red-white border of the lip, and we inject in a retrograde fashion. And place the filler in the subdermal level. Showcase Pluryal to enhance and reshape the frontal part of her cheek, the frontal projection, as well as we did build up a foundation to rebuild volume in the lower part of the face at the prejowl sulcus area to fill here and lift the corners of the mouth.